Okay, so in this video we're going to look at the structures of the knee joint. So the knee joint, it is made by the femur proximally and the tibia distally. The fibula, although it's lateral and distal to the femur, it is not actually forming part of the knee joint, only the tibia. Now here, this is the anterior view of the knee joint. So here we have the tendon of the quadriceps femoris, which is the great extensor of our knee. And then here underneath the tendon of the quadriceps femoris, we have the patella, and then below the patella we have the patellar ligament that inserts into the tibial tuberosity here in the most proximal and anterior part of the tibia. Now, just to orient yourself what is lateral and what is medial. So here we have the fibula. The fibula is lateral in the anatomical position, and the tibia is medial. So we have a couple of ligaments here on the sides of the knee joint. So this one will be the lateral collateral ligament or the fibular ligament. So is this is the lateral collateral or fibular ligament. And then in here in the medial view we have the medial collateral ligament or tibial ligament. Okay, now posteriorly you can see more what parts of the femur and what parts of the tibia makes this knee joint. So here, this will be the condyles of the femur, and these will be the condyles of the tibia. So this joint happens between the knee joint, between the condyles of the femur and the condyles of the tibia. Now, how can you tell which condyles are medial and which ones are lateral? So again, refer to the fibula. So the fibula is the thin bone of our leg, so this is lateral, and then the tibia, which is the thick bone of our leg, this is medial. So these two will be the medial condyles, and these two will be the lateral condyles. Now, within the internal structures of the knee joint, we have two pads of fibrocartilage that we call the menisci. So menisci is for plural. And then we have the medial meniscus for singular. So this pad of cartilage is called the medial meniscus, happens between the medial condyle of the femur and the medial condyle of the tibia. So this is the medial meniscus, and then of course across will be the lateral meniscus. These pads of fibrocartilage can get damaged during sudden twisting, torsion of the knee, and then they need to be repaired. Now this is the intercondylar fossa of the femur, and running between the internal portion of the intercondylar fossa to the posterior portion in between the condyles of the tibia, we have this posterior cruciate ligament that sometimes extends up to here, up to the lateral condyle. So this is the posterior cruciate ligament. Now, running between the lateral condyle of the femur and the intercondylar eminence, which I'm going to show you, which is this here of the tibia. So this is the intercondylar eminence. So running here between this lateral condyle of the femur and the intercondylar eminence or tubercle, this is the anterior cruciate ligament. So these two cruciate ligaments, they cross like this. So they make like crossing. So that's why they're called cruciate. And what they do, they prevent excessive translation of the femur over the tibia. So when you want to test for these ligaments to see if they weren't torn, what you will do is you hold with one hand the tibia and the fibula of the person just around the tibial tuberosity. You will hold it like this, and then in order to test for the anterior cruciate ligament to see if it's not damaged, so you will have the person with their knee bent on 45-degree angle when the person is sitting, and then you will hold the tibia, the distal portion of the tibia like this, and then of the femur like this, and then with your left hand, if you're right-handed, you will be holding the femur with your right hand and the person's leg with the left hand. You will pull anteriorly for testing for the anterior cruciate ligament. So you will pull anteriorly the tibia over the femur, and if you see a translation or a movement greater than 6 millimeters, that will be a positive test. This is called the anterior drawer test. Now the posterior drawer test is doing the opposite. So in this case, you will push the tibia over the femur like this, and then if you see translation or movement of the tibia over the femur greater than 6 millimeters, that will be positive for torn posterior cruciate ligament. And if you see here, then you can see the tibia, the patella, that it is reinforcing this knee ligament. So at some point, these ligaments are very important to stabilize the knee joint, and anything that can damage the knee joint has to be assessed. First with this clinical test of the anterior posterior drawer test, and then you can do some imaging studies. So this is all then for this video, and I will watch you in the next.